Logistics is one thing, but getting the public to trust the COVID-19 vaccine is quite another. Fighting misconceptions and misinformation is and will continue to be one of the biggest challenges. That is something New York City health officials say they must work diligently to fight.
So the more we can help people understand the science as well as build their trust that we've reviewed the data ourselves, we're hopeful that this will have a big impact.
You can count on me receiving the vaccine after I've reviewed the evidence.
Manhattan residents Lucy Hahn and her husband Brendan Gill have already taken the vaccine through the Pfizer clinical trial. They hope sharing more about their own experience will help others gain more confidence in this medicine.
I believe in technology and the science. They actually did their due diligence.
Hahn and Gill took part in phase 3 of the trial at the end of October. 2 doses later, both admit they did have symptoms they were warned about. For Hahn, after the first dose, and for her husband, after the second.
I just started feeling hot. I thought I was just like had a hot shower. I just really little. So and then I took my temperature. My temperature was up to 101 at one point.
For now, that was the extent of the major side effects. The trials and vaccine itself have not yet been around long enough to determine what happens 6 months from now. That will be among several questions the FDA panel will ask Pfizer this week in a hearing that will determine if the coronavirus vaccine is rolled out to the public here in the U.S. As we wait for that, New York City's infection rate on a 7-day average is 4.94%. Hospitalization rates monitored daily, and infection rates among those hospitalized rising to levels health officials are not happy about. Staten Island as a borough continues to hold alarming numbers, as evident by the city's own data and the darker coloring on this COVID-19 tracking map, though the mayor's saying today the problem is far greater than just one borough.
We can expect in a matter of days new restrictions. No one's happy about it. I feel for the small businesses that might be affected and their employees, but this health situation has to be addressed.